Hi there. The intended learning outcome of this video is for the students to describe what patient-centered care is and how high-performing healthcare organizations achieve the aim of patient-centered care. In a previous video, we've discussed the STEEEP framework. And as you may remember, the STEEEP framework is one of the most influential frameworks uh, that is used to guide the efforts to improve healthcare and enhance the quality of care provided. The framework was introduced by the Institute of Medicine, and it introduced the 6 aims for improving healthcare. And these 6 aims are healthcare provided to patients should be safe, timely, effective, efficient, equitable, and patient-centered. In this video, we will focus on the 6th aim: healthcare should be patient-centered. What does that mean? This means that healthcare provided to patients is respectful of and responsive to patient preferences, needs, and values, and that this care ensures that patient values inform clinical decisions. High-performing healthcare organizations. An attribute of high-performing healthcare organization is that they use processes of care that ensure that patient needs and preferences are addressed. In other words, they use processes of care that ensure patient-centered care. Let's look at these 3 examples of published articles in the news. These 3 news articles highlight the importance of providing patient-centered care. The first 2 excerpts highlight the need to ensure culturally inclusive food menus in hospitals. This is an aspect of healthcare that is patient-centered, ensuring that food options on the menu satisfies the tastes of the diverse populations served by the healthcare organization. The third excerpt highlights the importance of seeking alternative care options when cultural values restrict the available options, as you can see from the title here. In the following section of the video, we will discuss how high-performing healthcare organizations ensure that care provided is patient-centered. What do they do? An attribute of high-performing healthcare organizations is that they are led by strong, visionary leadership that is committed to patient-centered care. The leadership and the clinicians in high-performing healthcare organizations are involved in designing care processes that ensure that patient needs and preferences are addressed. In addition, high-performing healthcare organizations emphasize patient involvement in decision-making and include patient satisfaction measures among their key performance indicators. High-performing healthcare organizations employ clinicians and staff who believe in providing patient-centered care. Doctors, nurses, and other professionals involved in patient care believe that their success in communicating with the patient and family is a critical element of patient-centered care. Teams, not individuals, provide healthcare. The interdisciplinary approach to healthcare involves team members from different disciplines working collaboratively with a common purpose to set goals, make decisions, and implement care interventions and evaluate outcomes. This is the definition of interdisciplinary approach to healthcare. What does it mean? Health High-performing healthcare organizations integrate individual professionals from different disciplines to build interdisciplinary teams capable of delivering individualized, patient-centered care. These interdisciplinary teams develop care plans that ensure individualized, patient-centered care. The concept of patient-centered care is embedded in care plans prepared by these interdisciplinary teams. Functional protocols. An attribute of high-performing healthcare organizations is that they use functional protocols to standardize clinical and other work processes. Using protocols allows healthcare providers to offer appropriate services to patients. These protocols provide examples of agreed upon best practice information that clinicians should consider when they are making clinical decisions and when they are providing care. Thus, a high-performing healthcare organization in their design and continuous improvement of their functional protocols ensure that these protocols guarantee patient-centered care. So functional protocols of high-performing healthcare organizations ensure patient-centered care is written in their protocols. Another attribute of high-performing healthcare organizations is that they educate, motivate, and reward their workforce. And this, in, in regard to patient-centered care, high-performing healthcare organizations provide continuous training and education to care providers that involves education on providing patient-centered care. Education of patient-centered care aspects is embedded in the education programs the organization provides to its professionals. Also, high-performing healthcare organizations recognize and provide rewards to teams and professionals for applying patient-centered approaches of care. High-performing healthcare organizations are constantly engaged in efforts to improve their performance, continuous improvement. In their continuous improvement efforts to improve processes, they are mindful of transforming processes to ensure patient-centered care, and they utilize evidence-based guidelines in their continuous improvement of processes. That was it. Thank you.